Thank you very much, Chair. And I want to thank the Senators for their invitation to meet with them here this evening. And we're here to discuss one of the most fundamental reforms in health services in recent memory, the implementation of the Progressing Disability Services for Children and Young People programme, or PDS. And it would be disingenuous of me not to acknowledge that the HSE has had considerable challenges in parts of the country implementing the PDS programme, and we're only codding ourselves to say otherwise. It's important also to say I'm here as Minister for State with responsibilities for disability in the Department of Health. I'm not a spokesperson for the HSE. Unfortunately, and sometimes it's hard to defend the undefendable. Unfortunately, this has resulted in delays for families to access much-needed therapies for their children, and I want to put on the record my sincere apologies to any family experiencing such delays, and I'm sure the HSE does as well. Historically, children's disability services have been provided by a range of statutory and non-statutory service providers that delivered services based on child's diagnosis or age. The type and level of service provided varied widely across the country, and some children received an excellent service and others little or no service. This variance has been linked to diagnosis, age group or geography. PDS, on the other hand, sees the reconfiguration of children's disability services across all statutory and non-statutory organisations into children's disability network teams. And the aim of these teams is to provide equitable child and family-centred services based on child's needs rather than diagnosis or where the child lives or goes to school. As part of the PDS programme, children's disability services are changing from diagnosis-based to needs-based, so that all children with a disability or developmental delay have access to the right service based on their needs, no matter where they live or where they go to school. Our clear objective is to end the unacceptable, inequitable access to therapeutic supports that children with complex functional needs rely on to achieve their potential. The National Policy on Access to Services for Children and Young People with Disability and Developmental Delay, a single point of entry, signposts parents and other referrers to the most appropriate service. Senators may not be aware, for example, but the HSE Primary Care Services provides supports for children with non-complex functional difficulties, while Children's Disability Network teams, under the remit of the HSE Disability Services, provides for children with complex functional difficulties. Under the PDS, Children's Disability Services are delivered from 0 to 18 years of age. This means we no longer have the inexcusable situation where a child ages out of early years without ever having been seen in early years, and they go to the bottom of the waiting list again as they go to the school-age team. 91 children's network disability networks are aligning to 96 community health networks across the country, and on full reconfiguration, every child across the country with complex needs arising from disabilities will have access to the Children's Disability Network teams. And you can see from what I have provided for you there, CHO1 has 9 such teams, and that has reconfigured or taken place there in September 2021. CHO2, there's 6. October of this year, they're reconfigured, and 3 in Mayo, which are going to happen, they'll be the last, will be of December of this year. There are 7 in place in CHO3, and there's 14 in CHO4, which would have been the Cork Kerry area. And I know some of the senators might be aware of it, but we have huge issues in the Cork Kerry area. And they would have been reconfigured long before the absolute, where we find ourselves at the moment, where there's an awful lot more teams coming on base. CHO5, there's 12 teams, and they're in place since December 2021. CHO6, they're there since September, 13th of September this year. CHO7, 11 reconfigured since the 20th of December, and CHO8, 4 have come on board there the 25th of October, and there's 8 more. The last will be 8 will be in November. And 12 are in place in CHO9 since September of 2021. I think it's important to recognise here, when you see how the mass reconfiguration that's taking place out of, when you leave aside CHO3 and CHO4, you see the flurry of work that's taking place right across the country with that reconfiguration. I think it's important to put it in context what reconfiguration means. It means actually we're upsetting our apple cart completely. We have lead agencies, which could be Enable Ireland, Brothers of Charities working with HSE providers, and they're all coming together to formulate onto teams. And some people might never have worked as part of these teams before. It's also important to say as well, a lot of the HSE teams, believe it or not, were working off paper, and they were handing over paper files to some of the lead teams. So when you're looking at what we are handing over and what we're trying to pull together, it's very, very vast, very, very complex. But not only that, we never had a real true figure till we've seen the true figure as they're coming through at the moment onto teams. And I know when I talk about CHO4 and where we have Enable Ireland gone in and they're doing phenomenal work down there, and talking to the CEO of it in one day, I was asking how many teams, and they were expecting 872 was the figure that they were given from the HSE. In actual fact, they had gone to 1,800 of the caseload on one particular team. So I think it's important to put it in that context so that people have an understanding of when we talk about the reconfiguration, it's not just taking it from one side of the table and putting it to the other. It's an awful lot more vast. We're moving staff around the place, and we are actually expecting people who have never met before to start working together for the first time. And then you have to think of the families and the children, and you have to think of the letters and the lack of letters they're getting and the lack of information and they not knowing what's going on. So it is completely in a state of flux. But for the first time, I can give you dates and timelines as to where the reconfiguration stands. I'm standing here before you today, and I don't have a number on every single one of those 91 teams, and it is my objective to get there. So the teams are made up of a range of health services, and I've addressed that, and this includes universal target and specialist support such as an individual therapeutic intervention and access to specialist consultant and assessment when needed. Supports will be provided as feasible in the child's natural environments, their home, their school and their community. What cannot be disputed is the unprecedented level of additional resources which has gone into strengthening therapy services. Since 2019, 285 therapists have actually added on to those teams. But still at the same time, we're still short approximately 400 more staff. We're also in very much a labour market that's women, predominantly females, and at all times we're seen to be down 40% of our staff. For various reasons. And I'm also pleased to inform the senators that further investment is planned in 2022, which I will announce in my HSE service plan. So there's more staff going to be coming into this. But for the first time ever, I'm glad to tell you tonight, I'm also going to ensure that there's admin staff, because we have therapists doing actually the secretarial work. We have therapists writing the reports, we have therapists writing to the parents. We want the therapists delivering the services. They need to be supported with the skill set of the admin staff. And in actual fact, when we get to that stage of balance, I believe we will have a functioning service. I don't think we have one there at this moment. Moving to the issue of assessment of needs and assuming ministerial responsibility, you've heard me talk about this more than once, and I'm not one to rehash, but it was good news that we actually did clear a backlog down to 500. That was the story there and then. That is not the story now. The story now is that, and I must be honest with the House, that I am disappointed to learn that the HSE in recent weeks, while with phenomenal work was done in clearing the backlog in the middle of a pandemic, the latest assessment of needs quarterly data from the HSE shows how they have backtracked on their own progress. And this is a total number of children waiting on assessment of needs, including the backlog, equates to just under 4,000 people. So we have spent a lot of time having committees discussing how this SOP was supposed to work. And I was always led to believe that the backlog in relation to the assessment of needs, that was under the old regime where it could have taken up to 20 or 30 hours to get an assessment done. Then there was going to be the SOP and it was a direct intervention. We should never have been in a state in September, October, November of this year where we would have a backlog. And I'm very disappointed. And I says, I'm not here to defend the HSE. I'm here to be very honest and open and transparent. And part of my honesty and openness and transparency is I would agree, I have one for everyone in the audience here in relation to the latest third quarterly management report assessment of needs process. I think it's important that you familiarise yourself with this, and you will see what I haven't in my 10 minutes that was allocated to me to address the issues in relation to why I'm so disappointed that we have built up a backlog. And in all fairness, I've seen the letters that have circulated and how disappointed ye senators have been, but most importantly the parents have been, and how when you read this report you will see how the parents, when they say to you we're not being able to get a service, we're not getting responded to, and we don't know when we'll have a date or time, this report clearly says it. I look forward to coming back in later on.
Minister Rabbitte, thank you very much for your very honest and refreshing approach in terms of your statement. It's really refreshing to see someone of your calibre come into the House and share that with us. I now like